We all know it's super horrible, no question about that, but is there something we can do to prevent it? Of course there is. Spine surgeon Dr. Melamed is here with the answers, how to keep your spine young, just in time for World Spine Day. When we come back.
And your heartbeat.
Tomorrow is World Spine Day. We've invited the board-certified surgeon Dr. Hooman Melamed to give us tips on how to keep our spines as strong and healthy as possible. Hey, tomorrow is World Spine Day. It's a time for everybody to focus on the 33 stacked bones with muscles and ligaments that keep us upright and moving.
And Dr. Hooman Melamed is a board-certified spine surgeon. He's here to walk us sort of through those crucial days of life in which we can actively make changes to keep our spine strong and healthy. Thanks for being here. I was doing yoga once and someone said to me, the spine, you're only as young as your spine. And I think it's so true, but it's a lifetime commitment.
Absolutely it is. You know, I get asked a lot, like, what can I do, one activity? There is no such thing as one activity or one thing. I like to look at it as a lifestyle commitment to it. You know, more of a holistic approach. It's a combination of diet is very critical now. We're learning exercise properly and getting in good habits from early on to set those habits, because, you know, if you don't have bad habits, you don't have to break them as we get older.
All right, well, let's talk about the decades. In your 20s, what is happening to one's spine?
So if you look at the spine here, the discs here, we have a spine model. This is our last disc. This is the pelvis here, the last disc. This is the bone here, the vertebrae, the bone, the disc, and the cushion. These are the shock absorbers or the cushion. The degeneration process really starts in our 20s, and it's very critical to get in those good habits like I was talking about. So it's critical to get into a good cardio program, a good Pilates, yoga, weightlifting program, you know, involving all the muscles, like your fast twitch, slow twitch, intermediate, you know, get into good habits, start doing this. And also the diet, getting on an anti-inflammatory diet, avoiding dairy, avoiding gluten, basically, turmeric, ginger, all those things, you know, getting in a good diet, get the habits, you know, because if you have a good anti-inflammatory diet, it prevents inflammation in your body, and that actually helps to prevent this degeneration as time goes on. Smoking is another thing. Smoking ages your spine like crazy.
Don't point at me!
Smoking ages the spine. No, smoking is really bad. So these are the habits that start
all sorts of things.
So these are what sets it.
Well, in your 30s too, people get a very active weekend warriors.
Weekend warrior.
You know, he plays basketball. Like it's a lot, but is that good or bad?
That's very bad. I see so many injuries.
What do you mean it's very bad? It's wrong to play basketball in your 30s?
Basketball is great, but don't do it just on Saturday or Sunday. You got to keep it consistent like 4 times a week. You got to do the exercises.
That's not
possible. What about 40s? What about water?
40s, you know, it's about remember, the degeneration process is continuing. So being obviously very hydrated, you know, stretching is going to become critical, especially stretching after you exercise. It's like counterintuitive, but stretching is very critical afterwards to keep the muscles and joints basically from getting sore afterwards. And there is no reason why you can't compete at a very, very high level, like triathlete, very high exercise at that age. If you do everything properly, getting up at work. A lot of people become sedentary. You got to get up, like, you know, get people like a standing desk, move, become very active.
And when you become 50, specifically for women, osteoporosis becomes a problem, doesn't it?
Absolutely it is. Absolutely it is. So that's why I say if you go back to your 20s, if you do this stuff properly, the proper nutrition, you avoid the osteoporosis. We get older, we got to be careful about the high impact activities. You know, if you're running, a lot of people running, no problem, run on soft surfaces, on grass, like rubber, on the sand. The cement, the pounding is not.
Well, let me ask you. I mean, I'm right between my 40s and 50s. Let's just say, and I play basketball once or twice a week. Once or twice a week on wood. Is there? Am I killing myself? Is it horrible for me, or am I okay?
Once or twice a week, no, it's fine. But I mean, once or twice a basketball is not good because you're more injured. If you're not doing some kind of a yoga, Pilates, plyometric, you know, with the TRX, like balance training and stuff like that, those are what keeps you really your dynamic stabilizers, your muscles, it keeps your back from getting injured.
And on that note, I think about like 60s and even my parents in their 70s, and like sometimes I've almost tripped downstairs before. If your core is not strong and your lower back and back not strong, then you're going to fall.
Absolutely, it is. And you know, the other thing is that we get older is what people don't realize, that I have a knee injury. If you don't take care of that, you're more at risk of spine problems, hip problems. These are all connected. It's a big chain. It's like having a symphony one person in the symphony kind of doing their own thing. The whole thing is not going to look good.
If you're like Sam, you're like, between 55 and 60, you're approaching 60. Is there anything that you could say specifically to Sam Rubin? And you've seen his body type.
I would say,
Stay strong.
Sam, I mean, I would say if you're not doing Pilates, you should be doing Pilates. I'm a big proponent of
something.
that.
You do orange
Yoga and a
therapy.
good diet, basically, on that.
All right, good
Orange
diet.
theory. He works out a lot, actually.
Sure he does.
Sam's
But
good at
proper
it.
workout techniques
Sam,
also.
I got your back.
Proper workout techniques is critical.
Doc, good to see you. All of these tips
Thank you, guys.
posted on KTLA.com. For more information about Dr. Hooman Melamed and his advice for a strong and healthy spine and back, go to thespinepro.com.
Yes, I like it. Thank you so much.
Thank you, guys.